Now let's turn a second to the implementation of interprofessional teams. I hope that I've convinced you, I really hope that I've convinced you, this is how we should be practicing care in geriatrics. We should not be practicing in isolation. We should be practicing together with a broad panel of interprofessional healthcare professionals to really improve outcomes, as we've seen can happen when these models are implemented correctly. And I hope that you're thinking, how can I do this in my environment? How can I change my system of care so that it better fits the actual needs of older adults? So when you're thinking about this, you have to know the available models. That's why we just talked through. And you have to really put your business hat on and think about a business plan and a clinic protocol. What is this going to look like in your environment, and how is it going to fit in with your overall healthcare system's model of care, payer environment, available staffing, and how can things be reworked to fit one of these models of care or a new model of care of your designing. And then you have to be ready to train your team and, of course, track outcomes, constantly quality improve so that you can fine-tune your model, fine-tune your team, and improve patient outcomes as you wanted to. You have to think about the elements of interprofessional team practice when you're designing these teams. Make sure there are clear roles so that individual team members know their responsibilities and can act on them. You have to ensure that there are clear team procedures so that there's accountability. You have to coordinate, and you have to make sure there are adequate venues for communication in terms of team meetings or digital communication via things like Microsoft Teams or whatever, or Epic, whatever model of communication you're using in your practice. And you have to be willing to cooperate. And just as important as cooperation is you have to empower your team members to be assertive when they have something to say that is important about an individual patient's care. All voices have to be heard on an interprofessional team or the model will fall apart. And you have to trust in your individual team members' ability to enact their entrustable professional activities and their roles on your team. There has to be mutual trust and respect, and a respect for each person's autonomy within the team structure. Each person has to feel valued. And so it turns out there are evidence-based models for training your interprofessional team as you're getting started with this. The Hartford's GIT program is available for purchase, but unfortunately it's no longer being updated. One of the more common models that's used here in New York City is Team Steps, which was developed by the Department of Defense. Evidence-based interprofessional team training has a curriculum guide, slide sets, videos, and live training as well, and is kept current and active by both, I think, by the AHRQ. So let's stop again and think about this thought exercise that I've just engaged you in. Pause the video after I finish talking and think about what are the barriers to implementation of interprofessional care in your workplace, and how can these barriers be overcome? Take a second and write down your answers, and we could talk about them when you come into clinic.